everybody. I'm Sister Jacky. I'm working with TB HIV care, but we are based here at the mosque, where we do blood pressures, we do sugar testing. You're welcome to come any day except on a Friday. We open from 9 until 1. So you're welcome to pop in to come to your blood pressures for free. Okay? And then we also do home-based care where we wash the patients at home, the people that need to be washed at home, we do that. And the most important thing that we do here in Parkwood is we're fighting against the spread of TB. Ne? So the TB infection is on the rise, so we don't do the sputum testing here, but we refer the people to Parkwood Clinic. Okay? Are we starting with the program now already? So we're going to start with TB, and we're going to call up Kashifa, one of my nurses working with me, so she's just going to give a little talk about that. Thank you.
Hi, good morning everybody. Assalamu alaikum everybody. I'm Kashifa. I'm going to speak about TB. Do you know what TB is? TB is caused by a germ that is breathed in. It gets into your lungs and it grows in, which means it stays there. So it makes a hole into your lungs. It may also affect other parts of your body. So you can see your, Do you know how long you will have to take your TB treatment? To get well, you will have to take your TB treatment for 6 months. With some form of TB, you might need to take TB treatment for longer than 6 months. Your clinic doctor will tell you if you need to take treatment for longer, which means is if you do stop your TB treatment, you will go longer on your treatment. So this is the only way to get rid of the TB germ. Even though you may be feeling better after 2 months, you will not be rid of all the germs yet. You must complete 6 months of daily treatment to get rid of all the TB germs. You will call this your TB journey. It starts when you take your first tablet and finish off after 6 months when your doctor or your nurse tells you to stop your treatment. As you can see here, do you know how and when you will be taking your tablet? To get well, you will have to take your TB treatment for 6 months, like I said. With some form of TB, you might need to take treatment for longer than 6 months. Your clinic doctor will tell you if you need to take your treatment longer. This is the only way to get rid of the TB germ, even though you might be feeling better.
That is some education about TB. So we get referrals from Department of Health, okay? Where people are went to the clinic, tested positive, and then we must go check up on them if they're drinking their tablets. So that we do weekly, just to see that they adhere and not spread the germs. So whoever is coughing for 2 weeks and it's not normal for you guys, you're welcome to come to me, then I will give a referral letter to the clinic. Mense, julle hoef nie bang te wees om te sê julle TB nie. Want TB kan julle enige plek optel, by die mosque, by die kerk, by die shopping centers. Nee? So moenie skaam wees om, solank julle net gesond kan raak en nie die germs spread nie. So ons by outreaches buitekant ook, maar ons praat met die community. Okay, next up will be Peter. Peter's going to just have a small talk about HIV.
Good morning everybody. Here to do a small basic of HIV. HIV is a virus that attacks the immune system. It destroys the CD4 cells that protects us from getting infections. With well knowledge and treatment, it doesn't have to control our lives. HIV is normally spread through unprotected sex, breastfeeding from mother to child, and also from needle sharing. You cannot spread HIV by shaking hands or sharing food or hugging. That's what's important to know the truth, because fighting HIV means fighting the stigma. The best tool we have is prevention, regular testing and consistent treatment. In closing, a person with HIV can live as long as a normal person that doesn't have it. Thank you.
Now it's coming to myself. Okay, I'm going to talk about blood pressure. Blood pressure is a silent killer, people. You may not experience or get any symptoms like severe headaches or feel tired. Like I say, it can make you sick. It can come from family history. Okay? But first of all, I want to start with how it works. Okay? So, you know that the heart is divided in two. And the heart is a muscle. So if you do this, can everybody just do this? And you feel, hey, the muscle is stretching stiff here. Okay, so that is the heart constricting. And then you relax, that is the heart, when the heart is relaxing and pumping out the blood to the rest of your body. Okay, so the heart is a muscle. So when you eat fatty foods, high intake of sugar, okay, those stuff will sit in your arteries, okay, and it will build up until the arteries get too thin that the blood can't go through the arteries, okay, and blood carries oxygen, and we all need oxygen to breathe. Now that oxygen goes to the brain, okay? So the minute the heart pumps and it can't force the blood through. That is the reason why some people get strokes, because there's not enough oxygen or blood flow going through to the brain. So everybody can just take their 2 fingers and just place it here. Can you feel the pumping, the pulsation? Okay? That is how the heart pumps the blood against the wall of the arteries. That's why you can feel the pulsation in your neck, all over where it pulse, but the main thing that you must know is the artery here. Okay? So like I said, when you go to the doctor for a blood pressure reading, did anybody see that the numbers on the doctor's monitor that says maybe 120/80? So the top one is where the heart constricts, né? That is, I make an example, that's 120. That is a normal blood pressure reading. And then the 81, the lowest one, that will be when the heart push out the blood to the rest of your body. Does everybody understand? You look like I'm lost. Everybody still fine? So everybody understands blood pressure, right? Like I said, you can get it from family history, so it's very important that you go maybe twice a year to the doctor just to monitor your blood pressure, or you can even come to the mosque where we can do it for free. Okay? Children can even get blood pressure. The way the children are not active nowadays, playing in the park or running around, playing football, they're mostly on their phones, couch potatoes like they call it. Ne? So children can also get blood pressure. They get blood pressure when you're overweight, blood pressure when you have stress. Ne? There's a lot of women. So the women are mostly the ones that have stress. Ne? Children come to the mommy, mommy, I'm hungry. Mommy doesn't have money to go buy food. Where's the money coming from? Or the school fees must be paid. So those are all factors that can cause your blood pressure to rise. Any questions so far? No questions so far?
For instance, I have hypertension, but for a couple of weeks I can feel my blood pressure high. So in the morning, I take the amlodipine, and then the doctors put me on a waterfall also to regulate my blood pressure. And during the day, I can feel, say for instance, I take it 6 o'clock. And then, like during the day, I can feel like 12, whatever. My blood pressure is still high because my daughter gave me a blood pressure machine. Do I take another, I'm on 5 more. Do I take another blood pressure course?
No, ma'am. I can tell you, keep a record. Get your piece of paper and a pen. You record your blood pressure. Okay? And then when you go for your follow-up doctor's appointment, you show the doctor your readings. Okay? And doctor can decide, okay, must I put the dosage up higher? And she can take blood tests and whatever. She can guide you on that. But if you don't feel good, ma'am, like are you living far from the base? Are you staying far from here, ma'am?
No, I'm staying here near the clinic.
You can come over to me. Okay, then we test it for you. Satisfied with the answer? Okay.
Yes, thank you.
So people, please, your weight, ne? That can also be a cause that you have a blood pressure problem. Ne? So check your weight. There is a sister that's going to talk about the balanced diet. Okay? Even you may experience blurred vision, dizziness. Ne? So please, I motivate you guys. We must look after yourself. Come to us and we will test it for you. Okay. Everybody understand blood pressure? Okay. Then we go over to diabetes. Bloedsuiker. Okay. You get the type 1 diabetes, where it starts from children, so from the age of 5 already. Okay. That can be also family history that people have sugar in the family. Okay. Then children that's obese, they can also test positive for blood sugar readings. So like I said, you're welcome to come. Okay? They can also, like, if you see your child, hey, this was a very active child, but now she's just, or he's just laying or feeling tired. That is also a warning sign, right? That you must check your child out. You get more types of diabetes, but I speak mostly about the type 1 diabetes and the type 2 diabetes. Like I said, type 1 is from childhood, where they're going to put the child immediately on insulin. Everybody knows about insulin? Baie gevaarlik. Jy moet 'n monitor masjien hê as jy op insulin is. Okay? Dan kry ons die type 2 diabetes. Daai gebeur meestal so middle age. Nee, so van 20s af en nou so lekker dat jy takkies eet en hy fish and chips eet, nee, en lekker samosas, al die vetterige goedjies, nee. So, julle is welkom om julle goedjies hier vir ons te kom toets. As ons nie vir julle kan help, ons refer vir julle na die hospitaal, na die hospitaal. Signs and symptoms of diabetes, wanneer jy sien julle urinate baie, julle kan baie pee, nee, julle is baie dors, julle blurred vision, okay? Some dames kry itchiness in hulle vaginas, okay? Julle skin kan baie iets, dit is ook 'n teken. Of julle mond, né, is droog, daar seertjies in, is rooi. Kom toets julle uit. Okay? Soos ek sê, ons vroumense is baie belangrik in die familie. Dit lyk my as die vrou nie daar is, dan val alles plat. Okay? Enige vrae omtrent bloedsuiker siektes? Verstaan almal? Okay, baie dankie. Ek hoop julle het iets geleer. Ek wil julle net boring maak vir julle om lang speeches te maak, solank ons net die basics kan ken. En asseblief mense, die wat diabetics is, kyk na julle voete. Okay? Die voete is die verste van die hart af. Soos ek gesê het, die arteries, as julle vetterige koekies eet, nee, of baie soet koekies, die arteries raak dun, die bloed kan nie vloei nie. Okay? So die bloed kan lang vat om by die voete te kom. En baie diabetic mense verloor hulle voete. So as julle buite kan loop, moenie kaal voete loop nie. Okay? Daar's klippies wat lê, daar's stukken glase wat lê. You can cut yourself. Okay? And if you see a wound takes long to heal, go to the doctor. Okay? And sort it out. Even when you walk on the beach, just be careful. Ne? The scalpel is it's sharp and it can cut you. Okay? So just be careful. The other thing is when you go buy shoes, those are all diabetics. Please do it in the afternoon. Your feet is a little bit swollen. Because if you buy it in the morning and you wear those new shoes in the afternoon, dan gaan dit druk. En julle kan blaasies kry, as julle nie kyk na die blaasies nie, dan kan dit erger raak. Okay? Droog julle tussen julle tone baie droog af. Okay? Hou julle voete moisturize. Moenie dat dit droog raak nie, want dit kan kraak. Okay? Enige vrae? Praat ek nog reg? Stel julle nog belang wat ek sê? Okay. So mense, dit is al van my, ons real outreaches, waar ons net eendag praat oor bloedsuiker, die ander dag praat oor bloedpressure, ons praat eintlik oor alles, né? Okay? Baie dankie dat julle gekom het, en baie dankie dat julle geluister het.
Thank you very much, Sister Jacky, for that beautiful and in-depth insight on TB and HIV. Do we have any questions one last time before we move on to our next speaker? Any questions that you'd like to ask? And also, I'd like to thank Sister Kashifa and Sir Peter. I'm not sure who he is, but thank you very much. Any questions before we begin?